you can do whatever you want to do. There will be a place for everyone in a field of medicine. And I think that's such solid advice as we think about, every time we make a next step, you're going to find your place. It might take a bit longer than you expect. It might not be the journey you think, and hence my stepping stones, but you'll find your place.
Welcome back to the WSPID podcast series brought to you by the World Society for Pediatric Infectious Diseases. I'm Dr. Linny Fong, a Pediatric Infectious Diseases physician working in Melbourne, Australia. You may remember me from the Syndromic Insight series where I co-hosted with Dr. Alicia Chang. We had some great interviews with PID professionals around the world and covered topics like syndromic surveillance, rhinovirus, gastrointestinal infections, the role of sentinel surveillance in assessing future health threats, RSV, and the use of artificial intelligence in paediatric diagnostics. We'd love you to go back and have a listen. And now to today's episode. Today we are charting the inspirational career of the WSPID president, Professor Asha Bowen. Professor Asha Bowen, OAM, is a clinician scientist working across the Perth Children's Hospital as a paediatric infectious diseases specialist and the Kids Research Institute Australia, formerly Telethon Kids Institute, as head of the Healthy Skin and ARF prevention team. Asha has more than 15 years' experience leading infectious diseases research, initiated clinical trials focused on issues significant to Aboriginal child health, healthy skin and ARF prevention. Asha is currently the president of WSPID, the first ever female president and an inspiration in the 30 years of the Society's history. Welcome to the podcast, Asha.
Thanks, Lenny.
So what we're going to do, Asha, today is we're going to start with some icebreakers. So my first question for you is, what did you want to be when you were 3 years old?
I was thinking about this. What did I want to be when I was 3 years old? I think that my first career ever was wanting to be a hairdresser.
Okay.
I don't know that that's that unfamiliar for kids. Like the idea of the first haircut you give yourself when you cut your fringe to sort of like a centimetre in length, or learning to braid and that sort of thing. I also was really keen to be a chef a few years later. And then my parents said to me, like, you've got to be mad. Chefs work at the most insane hours. They're not social beings. They can't possibly contribute. And it'll be a really hard career. But they never said that to me about medicine. So they clearly didn't understand shift work or what we end up doing in hospitals in terms of their advice.
Yeah, absolutely. Oh my gosh, there's such very typical sort of 3-year-old responses. I love it. And so, Asha, what would you title your autobiography if you were to write one?
So my autobiography is absolutely going to be called Stepping Stones.
Oh.
And I've often had this idea, you're kind of thinking about a river, and to cross it, you have to actually be able to pick out the next stone to jump to. And it's not predictable. Sometimes they're a bit rocky. You don't quite know they're going to hold you. And then you've got to kind of keep light on your feet and move on to the next thing. And I think that's probably been my career, really, is going places that I might not have expected to go, finding out things, learning from mistakes, being able to right yourself when things don't feel so great, and moving forward anyway and getting across that river. So, that would be the title of my autobiography. And now I feel like I might have to write it.
That sounds like a great title. And I think from that title, I'm sure we'll cover that in your leadership journey. We'll hear a little bit more about those stepping stones. My last question for you is, what is your favourite place to travel?
Anywhere?
Anywhere. Perfect. Good answer.
I do love traveling, and to be honest, I've always loved going outside of Australia to get to experience new cultures, new languages, environments where the food is different and all of that sort of thing. What I learned during COVID is that Australia actually has some pretty magnificent places. When we were trapped in this country, probably trapped is an unfair word, but, the borders were closed for over 2 years. And I lived in Western Australia, where our borders were even more strictly closed from the rest of our country. And so I had a huge opportunity to travel all over Western Australia. And from, diving with the whale sharks on up near Exmouth, snorkeling in Turquoise Bay, filming a hip-hop video on the Dampier Peninsula of Broome, going down to Albany and then hiking in the Carragini Gorge. Incredible vistas, amazing new parts of the country that I'd never seen before, and very grateful, I think, in that idea of travel. There's no perfect place. It's just that discovery, finding out new things and experiencing new opportunities.
Love it. No, that's great. Yeah, it's always nice to be able to venture out and learn new cultures, eat different food and see those amazing sights. So sounds
Yeah.
great.
What about your favourite place to travel?
Oh, my favorite place. I think I'm the same as you. I think anywhere where you're sort of out there and discovering new things is always a good thing. So we're going to jump into some of
Yeah.
these interview questions. And so I think that our Pediatric ID audience will be really interested to hear a little bit more about your journey into pediatric infectious diseases.
Yeah, cool. So it's always unclear where you start on that sort of one, isn't it? Like, is it when you decided to become a doctor? Is it when you
Mm,
decided to become a pediatrician? Or whether it's when you decide to go into pediatric infectious diseases? And so I think as a young child, I thought I was going to be a lawyer.
mm.
And I really wanted to be a lawyer. And then I kind of had a crisis of identity where I didn't know how I was going to actually help people and make a difference in that career. And not to diminish anyone who's a lawyer by any stretch. It was just something that I experienced and work experience that kind of went, oh, I'm not sure that's for me. And so then sort of set my sights on becoming a doctor. And when I was sort of thinking about it, I knew that about 40% of the global population were under 20. So I was like, well, there's going to be a need for pediatricians, and I want to serve global health, and I want to be involved in looking after lots of kids. So pediatrics it is. And then I met pediatricians and I was like, wow, I actually really like you. Like, can connect with you. I feel like there's a common purpose. There's some shared values, and enjoyed working in pediatrics. In the final years of medical school, I pretty much didn't see any adult patients. I preferentially chose all of these pediatric options, to the point the first day of being an intern, when a 75-year-old man had a heart attack and it was my patient, I was like, okay, what did the textbook say to do? I haven't looked after an adult for a long time, but I managed to work my way through it, and it was okay. And then fast forward, pediatrics, I think, is an incredible space to work in because of the shared purpose, taking care of children as well as their families. Like, you can never separate them out from the people who care for them. And so it takes an extra level of skill set, I think, to really embrace and to ensure the child's at the center of your decision making, but that the family is encompassed in that, and that your preferences and needs are a long way behind that in terms of making decisions. And then along the way, realize that infectious diseases is detective work. You know, we often get observed across the hospital landscape as being those people who can solve problems, who think outside of the box, who are unsure about what the evidence says, but definitely go and look at it. And then when you map out the evidence, go, oh, there's a lot of evidence free zones here. How can I figure out what the best strategy is for treating this particular child with this particular condition from the information that I have at hand? And so have, I think, found my perfect fit in pediatric infectious diseases, and I'm forever grateful for probably my first mentor, Pam Palizanthran, who works at the Sydney Children's Hospital, and probably some of the audience will know Pam. And a huge shout out to her. But she sat me down on a Friday ward round, 6 o'clock in the ICU, and said, "What do you want to do, Asha?" I said, "Well, I want to do infectious diseases, but it seems like it's really hard to get into." She's like, you can do whatever you want to do. There will be a place for everyone in a field of medicine. And I think that's such solid advice as we think about, every time we make a next step, you're going to find your place. It might take a bit longer than you expect. It might not be the journey you think, and hence my stepping stones, but you'll find your place. So, pediatric infectious diseases, I love. And it's such an incredible privilege to be the WSPID president and to then think about, well, how do you represent pediatric infectious diseases to the world? And what are the needs of our members? And then how on earth do we keep on growing this organization to really get the benefit out of the collaboration that exists?
Absolutely. Oh my gosh. So many great things that you said in there about just being a pediatrician and also just that detective work within infectious diseases. We're going to touch on one of those points. You mentioned not being able to separate the family and the child, which kind of segues into community.
Yeah.
So your work with the Aboriginal community has been quite transformative. Could you share some of the key factors that contributed to the success of your efforts in improving skin health to reduce sepsis, rheumatic heart disease, and its flow-on consequences?
Yeah. So I, in my pediatric infectious diseases career, needed to find training for microbiology. And so, speaking to the Australian trainees who might be listening, getting that 6 months of microbiology training, I think, is a challenge for all of us. It looks different in all different global contexts. So, other people won't understand that full challenge. But I decided to go to Darwin And that's in the Northern Territory where there are a larger proportion of Aboriginal people living in, I guess, more traditional ways connected to country than we might see in urban Australia. And so in that decision, I got to learn my microbiology skills, but actually started to think more deeply about, as an Australian pediatric infectious diseases specialist, how was I going to work with Aboriginal people to solve some of the health challenges? And to be honest, when I made that call to go to Darwin, I thought I was going for 6 months and then I was going to get to work in HIV. And HIV had always been my passion because it fulfills and has so cutting edge, so exciting, lots and lots of ways that we still need to work to improve the health outcomes for children and for pregnant women who are living with HIV and how we prevent mother-to-child transmission. So lots and lots of interest there. But I guess during my PhD, which I decided to do in remote Northern Territory, it was a randomized controlled trial. And there were maybe three things that were a big sort of motivators that have actually guided my career forward from there and have kept me on that journey. The first was that we needed to generate evidence with and for Aboriginal people to solve health outcomes. And so the trial that I led was able to do that. And we were able to find a good short course of oral antibiotics that worked just as well for treatment of skin sores. So that was, I guess, exciting. What you have to do when you're doing a PhD, and so our research community will be aware of this, is often you have to do a literature review. And I was so busy running the clinical trial that I didn't do my literature review until the very last part of my PhD. Which, memo to everyone else listening, is not the way you're supposed to do it. You're supposed to do that bit first to help understand what you're doing. But it actually was the right journey for me because what it revealed was I did a systematic review of all of the different studies over a 45-year period of children with skin sores across the globe. And startlingly and tragically, I think, found that Aboriginal children living in remote Australia actually have the highest burden in the world of skin sores. So 1 in 2 children at any one time living with what is sometimes, I guess, thought of as being a minor nuisance condition, but pussy crusted sores that transmit and infect others. And so this 1 in 2 children at any one time was much higher than sort of the 8 to 10% rate that we were seeing in lots of the studies from Asia, and probably about 30% rate we were seeing lots of the studies from the Pacific Islands in Oceania. So it was just a much higher rate. And so this is probably one of those nerdy scientific moments, but when you discover something and no one else in the world knows it, and I've learned this from some of my other scientific friends, you can revel in the interesting point of knowing that fact, but actually you've got to do something about it. You can't just leave it. And so I think that really set me on that pathway forward that, well, if we know that's the prevalence, 1 in 2 children at any one time, there's got to be ways we can improve on that. And so have then worked in partnership with communities to continuously try and improve that rate. And you did link it to rheumatic fever and also to sepsis. And so I think in the pediatric infectious diseases world, when I'm caring for patients in sometimes a tertiary or quaternary hospital, I see lots and lots of kids with invasive group A strep or Staph aureus. And I demonstrated in my PhD that both of those bugs are contributory to skin sores. And therefore, if you could resolve the skin infections, you probably don't need to treat as many downstream sepsis cases or sadly lose some children. So it kind of motivated me on that prevention side to really work on it. We also knew that these children having very high rates of strep A infected skin sores were also the same children at very high rates, some of the highest reported in the world, of rheumatic fever. And so an association between those two things, and then thinking forward beyond that, how do you start to change that trajectory? How do you start to influence? That requires research, advocacy, policy, guidelines, constantly thinking about, well, what is the evidence? How do we implement it? How do we affect change? And you're constantly learning. The curiosity keeps driving that.
Yeah, no, that's fantastic. And I think you pretty much epitomise what the whole clinician scientist journey is about, doing those lit reviews, discovering the evidence, and then trying to find a solution. So that's fantastic. I guess working with these minority communities as our First Nations people can present unique challenges. How did you foster trust and collaboration with Aboriginal communities, and what lessons can others learn from similar contexts from your approach? Were there any significant challenges, and how did you address those?
I think the most important thing is slow down. And something that was reflected in a talk I did this morning, and just the values of the Kalunga team that guides our research at the Kids Institute, is deep time. And deep time is a concept for Aboriginal people and probably for many First Nations communities across the world that has helped guide slow down and think, take time to get to know us, build trust first, and then we can think about working together.
Mm.
And as a clinician scientist, with an ambition as well as a desire to make a difference, you often want to race ahead of that. And so I think that's been the biggest piece is just that slowing down, allowing the space to learn
Mm.
and to recognize that whilst I've been trained very effectively as a doctor and then as a clinician scientist, it's being trained in the Western models of knowing, being, and doing. And we sometimes don't elucidate that because they're the common or the mainstream ways. And being really respectful that those same academies of learning exist within Aboriginal culture and how to access that and then draw those two pieces together and not privilege one over the other, but thinking about what can we learn from each other. And then once we put those pieces more closely together, how do we improve health outcomes together? And so, in a trial that I've just finished up in the Kimberley region of remote Western Australia, we did something called the STOP trial, and it was about seeing, treating, and preventing skin infections. And so, we're very familiar with diagnosis, the seeing part. We're very familiar with evidence based treatment. As hospital, I guess, pediatric infectious diseases specialists, we often stop there and we kind of have a public health framework to everything we do, but that prevention component was really strongly brought in by community members and has probably been the essence of the success of that trial. And to build in prevention, we really started to use some of the things I talked to come up with co-designed resources and tools that would continue to tell the story well beyond the end of the study. So we worked with communities and wrote in their local languages these books that they can understand better. What are the key activities they can do to prevent skin infections and how that also prevents rheumatic fever, as well as thinking about the environmental health and the circumstances within which people live and how we might be able to advocate for improvements and see changes happen. So that big prevention piece enabled slowing down, building trust, sitting with community. And even in writing those books, I've got many moments where we're sitting outdoors in the heat on a basketball court with a big piece of cardboard in front of us and writing down words and having a two-way conversation. Well, what is the word for healthy skin? And hearing back, oh, we don't really have a phrase for that, but sometimes we call it strong skin or good skin. And so had to expand our concept about, well, what in the English language is closely related to what the word would be chosen in a local Aboriginal language. And with over 300 languages, of which probably 200 are still spoken across Australia, that huge privilege of getting to hear that firsthand. And to be honest, most of the work was done by my team. So often just hearing the stories when they would come back of cultural opportunities that they'd had when they were on country. So lots and lots of things of how you do it is probably about letting go of your priorities and figuring out what the shared priority is, and then figuring out how together you can move that forward. And taking it slowly is really important.
Love that. So deep time. That sounds like a really good concept to take into kind of modern life, perhaps. But also just that stuff around collaboration is so important with community engagement. And I feel like, from your projects and what you've described, that co-design process and the community engagement is just a different piece to it. And it's a different skill from what we learn as clinicians and as scientists. So yeah, well done to you and your team.
Thank you.
So on to the next question about sort of, I guess, us as women in pediatric infectious diseases. I guess for you, with all of your amazing work as a female, leader in global health, what challenges do you think you've faced along the way? And how do you envision the role of women in leadership evolving within the pediatric ID space over the next decade?
Such a great space to kind of start to talk in and dig into. And To be honest, in pediatrics, we have a lot of female clinicians now. So we have lots of role models. But probably for the first um, 5 years of my career, I was surrounded by, after having Pam Palizantharan, the mentor I spoke about earlier, mostly male clinician scientists. And so every single time I put a mentoring application in as a junior researcher, and I guess this is something for all of our listeners to make sure you keep putting those applications in and asking, I'd ask for a female clinician scientist. And I really wasn't able to connect with anyone. And that has changed now. But that was probably one of those barriers. You had to actually keep on asking for what you wanted and accept that maybe it doesn't exist. And, or maybe you're just not connected into that pathway yet. And it's probably the latter that was true, not that they didn't exist. And so now have felt that I wanted to, as a woman clinician scientist, role model for the next generation what it looks like to really be authentic in that and not to have to try and represent yourself in the world in a sort of in a patriarchal society, not to have to represent yourself in the world as the way that a scientist might be seen by the general public. And in Australia and potentially in many countries in the world, it's often a white male in a lab coat. And there's no disrespect to that, but it needs to be diverse. We need to see all colors, we need to see all genders, and we need to be able to think about scientific problems from all of those perspectives, or we won't actually make the changes that we want to see. So I think finding a great mentor and continuing to grow that, I think, is one of those challenges. I think the more we see who we want to be, the more that we can be that person, and then it creates that opportunity for the next generation. So hopefully have modeled that for future clinician scientists that it's possible. It's possible to be quite successful. It's possible to be really authentic in that role and to, I think, maintain your values. And not to say that that's unique to women, but I do think as women, we connect to one another and connect to our values and our um, uncertainties as well as the opportunities in a different way. And to enable that is pretty cool. I must say, I have an all girl research team, and that wasn't by design. And I don't know that it will be always, but at the moment, that is who is working for me. And it's very fun to keep on nurturing those next generations and thinking about, well, who needs mentorship and where do I find the different people for those journeys for my staff and celebrating some of the things that connects us as women.
That's great. I love that. Tell me a little bit more about some of your mentors, though. You've mentioned Pam along the way, but can you describe perhaps some of the people who have mentored you along the journey and what qualities you found helpful or useful?
Yeah, so in Western Australia, we have some wonderful clinician scientists. So in my move to Western Australia, I think I've been able to connect with it. And I have three mentors who I continue to love working with. The first is Professor Fiona Stanley, and she is famous across Australia, both for her scientific rigor and integrity, as well as her engagement and advocacy. And so she was one of the first people who understood the connection between folate and spina bifida and has really transformed guidelines along with a large research team to achieve that. She's often been the face at the front and not necessarily always been the one who's done the work. And I sometimes feel like that. And so I am inspired by it's okay to be the face at the front and to help the work happen. I think Fiona has also demonstrated the really powerful importance of capacity building and growing up the next generation of researchers, particularly working in Aboriginal health, and holds really strong values. And I think that values-based scientist is the piece that I love. I also have a huge privilege of working with Professor Fiona Wood, who is also famous in Australia. And the thing that connects us is skin health. And she works very much on burns. And, her absolute vision is scar-free healing. Imagine that, like the suffering that we see when we're looking after children who've had a severe burn, the infections that come from it, the multiple surgeries, the impact that it has on healthcare delivery and how to do that. In Australia, we know that Aboriginal and Torres Strait Islander kids have a higher rate of burns and often have burns occurring hundreds of thousands of kilometres, or maybe thousands of kilometres is more correct, from a tertiary centre where they can receive burn care. So really love working with Fiona Wood, and her story is magnificent. If anyone wants to Google these women, they are incredible women. Um, and I think the values piece, the authenticity, and that real connection around healthy skin. And we continue to now work together on skin microbiome work, but also have a really nice mentorship relationship. And with both Fionas, they've introduced this concept to me, which I love, which is peer mentorship. And so they are often that senior mentor who I look up to and admire, but have created communities of women where we come together and have a yarn, have a cup of tea, have a dinner, whatever it is, but then connect and are able to encourage each other on our journey. And I actually love the models that brings forward. And I've got one more awesome superstar woman to mention, Professor Donna Cross. And Donna definitely, the values piece again, it resonates, but works in child health from a school-based approach. And so a lot of my research projects are in schools, and I have just learned a lot about not only how you do good research, but also how you influence policy for change. And I think as researchers, that's an important part of the journey, but it sometimes is the last thing we think of. And Donna, I think, always encourages me to think about that from the outset. What is the policy that needs to change? Well, what's the research that's required to get to there? So I'm very privileged to be surrounded by some amazing women. And I hope that I haven't really given you their stories, but the things that resonate with me in that connection, I think, have helped guide as well.
Absolutely. They sound like three amazing women, and I know bits and pieces of bits of their story. And yeah, I can see that would be a very privileged circle to be part of. Asha, you mentioned values a few times. What are three values that resonate with you?
So I really can't get away from a phrase that I sort of adopted as a university student, which was to go mad. And it was to go make a difference every day. And so that idea of impact and, changing the world to make it a better place, I think is very, very foundational. I think curiosity and trying to just understand things and also let go of your preconceived notions, which is a hard thing to do. So it doesn't always have to be the way you think it is, but understanding is, I think, a really important one. And then equity. I think ensuring that those who have the least opportunities to perhaps achieve some of the things that I've had the privilege of doing, that my science and my clinical work is creating spaces for them and is also improving health outcomes. So I think from that global health perspective, we always have to be thinking for what I would call the last and the least, so that we don't leave them there, but we create the changes that are needed. And the equity piece, to be honest, I think is systemic blockers to that are really entrenched. And so I think you need to be a great ally to enable yourself to be able to advocate, but also to step back and enable the voices to come through of the true people that you're trying to serve. So that's, I guess, three of my big driving values. And I love thinking about values-based science. And not just like science is not just about discovery, but it's about using the science to change the world. And for me, that's a really powerful and important thing. We've also just recently looked at developing a strategic plan for WSPID, which we'll launch this year. And in doing that, we have identified core values that came through from members. And so the values that we have identified as being really resonating with WSPID members are collaboration, advocacy, knowledge, and equity. And they also spell the word cake, which I quite enjoy.
Love cake.
So that's a little bit fun. But I think we see in WSPID so much collaboration. It started because of collaboration between ESPID and SLIPA as the two initial member societies who came together and said we could do something bigger and better. And subsequently, the member societies across the globe have sort of come together to create WSPID. And so that collaboration piece. I think in advocacy, we've done a lot of work in the last few years around antimicrobial resistance and particularly around vaccine pricing and immunisation equity. In terms of knowledge, or you certainly know all the things that are happening on the education portal, and it's incredible. And we heard very much from members about the importance of guidelines and the real need for WSPID to continue to drive that forward. And then I think equity is a foundational piece to global health. So, that aligns with my personal values, but I think I certainly can look at the whispered values and go, yeah, there's a place there for me. Those are probably on my second tier list of values or my third tier list. And we have to know truly what our first tier list are, but it's certainly we have a lot of values that we can bring forward in different circumstances.
It's fantastic. How lucky we are that we became PED physicians and trainees when we did.
Yeah.
So in terms of, that's a really good segue in terms of kind of the future of pediatric infectious diseases and I guess research. What do you see as the key priorities over the next 5 to 10 years?
So I actually think climate change is the biggest game changer. Disruptor is probably more than a game changer that we really need to be paying attention to from pediatric infectious diseases perspective. It's going to have equity impacts. It's going to be disruptive in terms of geopolitics, and that leads to more refugees, and it potentially leads to more circumstances within which people acquire infectious diseases. And so I think as PEDS ID people, we actually need to be paying a huge amount of attention to how do we slow down this process of climate change and how do we be prepared for those things that are coming. I think we've lived through a global pandemic. We've all upskilled during that. We have also, I think, shared a commonality where the children's voices weren't present at a high enough or loud enough level throughout COVID for decision makers to reflect back the needs of children. And so I think children were harmed by the decisions that were made to control pandemic, both from school closures and from, for some children, that was the end of their school career, their education. And for a disease that really didn't affect children, there was some significant off-target harms. And so I think our role as PEDS ID is to ensure that that doesn't happen again and to keep working in terms of pandemic preparation to think about, well, the next pandemic could be a century away, but it probably won't be. And what do we learn? What will we take forward? What should we let go of? So I think we have all had somewhat of a traumatic experience through COVID. We all had to learn a lot more about our personal resilience. We had to learn about leadership when it was sort of a volatile, uncertain climate that you're working in, and you don't know what that you jump to the next stepping stone, but it's a rocky one, and you don't know if you're going to fall into the water, and all of those things. So I think that we need to be thoughtful about the systems that we work in, the ability to influence those systems, ensuring that WSPID has a voice, reflecting up to global organisations that are involved in those decision making. And to be honest, I think we have a really exciting community where that's already happening. And so harnessing that in an ongoing basis to create, I guess, that voice on behalf of sort of the community of paediatric ID specialists, but also to create spaces for the next generation to come into that, to learn their advocacy skills, to learn how to negotiate, learn to think about, well, policy impacts of these things and learn from the lessons and the mistakes we've made so that those mistakes don't get carried forward. So I think WSPID's got huge opportunities. I could probably talk about every infectious disease under the sun, but I think those are two big things that we do need to pay a lot of attention to.
Yeah. Fantastic. What a great answer. I think, I hope that we moving forward have learnt from some of the perhaps mistakes and that we continue to carry those lessons forward, and hopefully a future pandemic isn't too close from now.
I don't think any of us are ready for it, right?
Yeah, well, yes. Well, hopefully we've learnt. But yeah, for all of our listeners who have been inspired by your work, Asha, what is one message or call to action that you'd like to leave with them?
I think that recognizing your privilege and your power to make a difference is a really humbling and yet inspiring space to sort of be in. And sometimes we underplay that, and sometimes we miss what our opportunities are. And so I guess it's that idea of recognizing as a PEDS ID specialist, you've actually overcome so many barriers already in your way. So you can do all the rest, and if you find the right collaborations and the right networks and the right people that you want to work with and who resonate with you, you're a world changer as well. So I look forward to meeting so many WSPID members, particularly at Congress in Bangkok in October, But, reach out to someone like me. Be brave and just say, hey, I really resonated with what you had to say about that. Can you talk more about it? Or recognize your own power and recognize your own strength. And when things seem hard, keep holding on to that. Don't let it go. Don't let that light go out, because there are times that are challenging. But I think we have so many great skills to offer to the world, and let's think about how we use them.
Fantastic. Some great take-home messages there. Thank you, Asha. Thank you for your time today.
Awesome. Thanks, Lenny.
So for listeners, to find further resources and educational content, you can visit the Global e-learning portal on the WSPID website, your hub for Pediatric Infectious Diseases insights. And that's the end of today's episode. Thank you again to our esteemed guest, Professor Asha Bowen. We hope you've been inspired by her work with communities. And whether you're on your way to or from work or out for some daily exercise or doing the school pickup, thank you for listening to the WSPID podcast. Make sure you're subscribed on your favourite podcast platform so you don't miss an episode. Please share the podcast with your colleagues and leave us a review, and be sure to tune in next time. Thank you.